It's a difficult question to answer because of all the unknowns with this virus, and we've constantly had to change the way we go about our daily lives in order to adapt. Now, today I spoke with a psychology professor as well as several Las Vegas residents about their takes on what our future could look like.
I just don't know. I mean, I would like to say that, we'd be able to get over it quickly.
Ted Guerrero lives in Las Vegas but owns a martial arts business in San Diego. After hearing President Trump's three-phase plan for states to reopen, he's hopeful he'll be back to work, but is not quite so sure what it will look like.
The proper social distancing. Now, maybe with like a regular gym like 24-hour fitness, they can probably do that by splitting the machines up. People like me, I would assume it probably means I have less students on the mat. You have to separate them out more.
The Webb family from Henderson also hopes businesses can open back up soon so that they can enjoy their old traditions of going out.
Definitely would like to go to a movie again, maybe a little more distancing, maybe half of the auditorium filled or something like that.
UNLV assistant psychology professor Stephen Benning believes once places do reopen, it could be a little while before they feel like they did pre-COVID-19.
In the beginning of relaxing the social spacing guidelines, there will still be a large number of people who want to wait and see what's going on with everyone else before they go out and push themselves to do the same things that they used to do.
That's not the only habit Benning believes will take a while to return to. As 20-second hand washing routines and keeping hand sanitizer close by have become a necessity during this pandemic, he says some of these rituals may still stay in place.
I suspect that we will see the hand washing posters remain up, and there will probably be an increase in the number of people who abide by the World Health Organization's guidelines for hand washing length this way.
And for those who miss the connection of a handshake, Benning believes after a few more months, we could get back to normal.
Those individuals will see people getting back to normal and will probably have the same kinds of hunger for physical touch that is normal for human beings. Physical touch comforts us and provides us social support.
And freedom is what we want. Freedom is what we demand.
The city needs to open back up so these people can feed their families.
This is ridiculous.
Everyone's on house arrest.
This guy, he told people on unemployment last night to be more patient. They don't have a check.
Now, for his part, Governor Sisolak tweeted he had a meeting today with medical and emergency response experts on the state's reopening plan. He wrote that he will be presenting the updates to Nevadans very soon.
Well, Jim and Reed, they do say it's very complicated because models can only be so accurate. So health professionals here at the Southern Nevada Health District say that they're a little hesitant to say where we might be exactly on that curve today. Now, they do say the good news is it appears that social distancing we've all been practicing is helping. However, they do say that some data suggests that we haven't quite yet hit the peak for COVID-19 cases. Amidst the COVID-19 pandemic, the empty Las Vegas Strip and closed businesses are a sad and common sight. But when can it all begin to reopen? Governor Sisolak says he's looking to medical professionals for that answer.
I'm putting the lives of my fellow Nevadans ahead of any dollars.
But Thursday,
I'm going to go through the phases very quickly.
The federal government provided governors with guidelines to reopen their state economies. The three-phased approach gradually allows life to resume in the new post-pandemic normal. But to enter phase 1, certain basic criteria must be met in each state. There must be a sustained 2-week downward trajectory of COVID-19 and influenza-like cases, along with verification our state has strong testing abilities and adequate hospital capacity. So has Nevada satisfied these health requirements to try for phase 1? We asked that question.
In your medical opinion, do we even meet the gating criteria for proceeding to phase 1?
What? You want to take that?
So I haven't actually looked. I mean, I'm not as familiar with the president's criteria for reopening community at this time, so I can't speak on it.
Mary Hines has another question.
Well, that question was tough to answer. What health district professionals can confirm is that Southern Nevada needs more testing. Our state doesn't have the capacity, they say, to test those who have mild or no symptoms. As for hospitals, the health district says there's good news.
Emergency departments are not seeing above normal surge as it relates to people presenting with signs and symptoms of COVID-19.
Now, health professionals say it can be very difficult to draw conclusions from data that's constantly evolving and changing. They say they need way more testing and way more time to see how COVID-19 has spread throughout our community. Reporting live here in Las Vegas, Lauren Clark, News 3.
Lauren, thank you. Speaking of the
Probably the toughest job in Nevada tonight would probably be the state's top job. Governor Steve Sisolak is hearing it from all sides. Some say reopening Nevada too soon could risk lives. Others say reopening too late could risk livelihoods.
People are losing everything you worked your whole life for, everything. It's horrible. It's just horrible.
Terry Valiente has owned Alfredo's jewelry store for 26 years. She says regardless of the consequences, she has to reopen her store May 1st, especially since she hasn't heard Governor Sisolak offer any plan to reopen the state.
And I wish the governor would reconsider and just start opening up, because unfortunately, it's going to start with small businesses, it's going to go to larger businesses, and everybody's going to go bankrupt, and this is going to be his legacy.
During last night's COVID-19 update, Governor Sisolak offered words of encouragement and explained why this decision is so difficult.
The human toll is the most important to me. I am listening, and I will repeat this as many times as you'd like me to medical experts, to my scientific experts, and determining what is in the best interest of this community.
But business owners like Terry Valiente and politicians like GOP State Senate Leader James Settlemyre are growing impatient.
My overall opinion is that we have the ability, in talking to the medical experts that I've talked to, again, infectious disease experts for several of the counties, have indicated that if you follow proper safe protocols, there's no reason we couldn't start doing soft opens for certain businesses right away.
Regardless when it happens, financial expert Mike Pequeen says the governor and his staff need to give businesses some lead time so they can hit the ground running.
They need to know in advance what the timeline is likely to be so that they can start to prepare their staffs and orders of supplies and things like that. But I think that if we are patient and see the beginning slowly, it's going to be slow to start, but a slow start is a start.